Hi, and welcome to my collaboration and leadership reflection video for leading into professional practice 410 instructor Dr. Teresa Harpool. In this video, I will reflect on collaboration in ways it was successful and unsuccessful in achieving results. I will pinpoint poor collaboration and how it can result in inefficient management of funds and human resources. I will identify leadership strategies and interdisciplinary strategies to help achieve team goals. I will support my study with evidence-based literature that I found from Capella. While searching for evidence, I looked for current peer-reviewed articles. I also pulled from INS Edition 4. A little bit about myself. My name is Dana Germana. I've been a nurse since 2005. I've worked at telemetry, step-down, ICU, and now I work as a PIC nurse. On a daily basis, I collaborate with the hospital to reduce central line infections, or CLABSI. That's what I'll be discussing today and reflecting on. If I collaborate or communicate ineffectively, our outcomes are non-adherence to best practices and increased CLABSIs. So something we don't want here at the hospitals. Collaboration is successful when my team wants to educate nurses respectfully. I always find when I come from a place of wanting to teach and then they're more receptive to wanting to learn. Explaining everything that I teach is evidence-based. I guide them to INS, which is an excellent tool to make sure that we're following evidence-based best practices when we're, dealing with central lines. Also, annual compliance training will give nurses a review on all things central line, so we do that yearly. I've been successful when I understand a lot of nurses do not have the same knowledge base I have regarding central lines. I know that as a PIC nurse, this is my specialty. I have an extensive knowledge base that needs to be shared. The nurses look to me for guidance when it comes to line maintenance. I'm a member of INS. I keep up with my, every year, whatever comes out for INS, the new standards, so I'm always up to date, and I'm always sharing that information with the nurses. What I find is a lot of nurses, like I said, they don't have the same knowledge base that I have when it comes to lines. It's not their fault. It's just the way it is. I didn't have the information before I became a PIC nurse, so, you get sort of a broad understanding of central lines, but when you become a nurse who inserts central lines, you learn everything there is to know about lines. So I've been unsuccessful when I am short with the nurses. Do not take the time to educate and answer all questions. So I'm also unsuccessful when I don't educate the patient. What we always say is you need to be your own advocate, so they need to advocate for their line. To prevent an infection, patients need to sort of monitor what the nurses are doing, and I always, tell them in the nicest way possible. You can say to the nurse, did you scrub that hub? You want to make sure you're advocating for yourself. If you advocate for yourself, if you have a central line, it's less likely you'll get an infection. So, like I said, nurses don't know every nuance of a central line. That's what I'm here for. If I don't educate staff using INS best practice standards, they won't learn. If nurses are rushed for time, they might not adhere to best practices. Rushing sometimes causes them to, do things quicker. And when we do that, especially when it comes to central lines, we can give a patient an infection, and I'm always stressing that to the nurses. Okay, so in 2002, according to Pate in the Journal of Nursing Care Quality article, CLABSI rounding, the CDC estimates that 5% of all hospital admissions result in hospital-acquired infections. That results in 722,000 infections, leading to 75,000 deaths and $28 to $33 billion in additional costs each year. So, if we develop a lot of CLABSIs in the hospital, then it costs the hospital a lot of money. We have patient deaths. Length of time in the hospital is increased, and that falls on us. I mean, it's important that we're doing the proper care and education, collaborating with the nurses and doctors and team to make sure that, we're doing the right thing when it comes to central lines. Leadership can put initiatives in place to prevent line infections. According to an article by Ormsby, and the article is initiating maintenance bundles on their units hospital-wide, central line venous catheters maintenance bundles are associated with decreased CLABSIs. Bundle elements include discussing the CVC need daily, limiting CVC entries, disinfecting needleless connectors, changing the CVC dressing every day, 7 days, replacing needleless connectors, and administration sets per hospital policy. In the article, ICUs that monitored bundle adherence maintained a 95% compliance had significantly lower CLABSI rates. So, according to an article written by Wooten, Preventing Hemodialysis Infections, the CDC recommends a set of guidelines and recommendations that include removal of unnecessary central lines, daily audits, proper insertion techniques, central line checklists, and timeout procedures. All of these things we do here at my hospital. I'm involved in a team here where we round on the lines daily. We have a central line rounding team, so we have eyes on our lines every day. So we collaborate with the doctors and nurses whether there's a need for the line, if it's not needed anymore, or say it's femoral, we want to switch it to a PICC, we want to get the femoral line out as fast as possible. We want to make sure that we're teaching scrubbing the hubs. We want to see that the dressing is occlusive and not dirty underneath it. If it needs to be changed, we'll communicate that with the nurses. So we educate in real time. So if I find something right then and there, I try to educate the nurse as to what I'm seeing and what needs to be corrected when it comes to the central line. I watch for hand hygiene adherence, scrubbing the hub, and not connecting tubing to itself. Again, my tone is always one of respect and wanting to teach. I want the nurses to learn, and I want them to feel that I'm approachable. So they need to have questions answered, and so again, I have to always feel like I understand that they don't have this knowledge at their fingertips like I do, so it's important for me to train them properly. In 2003, Nursing made an incredibly easy article, published an article about CLABSI prevention culture. The article highlights the necessity of consistent evidence-based education in CLABSI prevention. Educators need to identify barriers to practice and engage in peer accountability discussions, something, like I said, we do every day. This way, nurses are empowered to be more proactive bedside. If we have a good culture here that, we do things correctly, I teach them correctly, then they'll pass that on to their, their fellow nurses. I worked at a Florida Cancer for a short time, and I was a PICC nurse before that, so I took a little time in between, and some of the nurses there said when they watched me do things, they changed their practice, so in a good way, so they learned from me, and that's important, to be the role model for nurses. Every year also I attend Infusion Nurse Conference, where I sit down with other like-minded nurses in my field. Collaborating and listening to nurses nationwide is a great way to learn new initiatives and strategies to meet hospital goals. We hear updates on INS standards, learn about new products, hear what's working and not working in hospitals. So all this is brought back to my facility and shared, making the hospital safer and run better. Safer for the patients, safer for the nurses, better all around. And lastly, annual compliance training, where nurses will get a refresher on central lines. So we have the mannequins, we have the lines, and they can come down every year. We'll set everything up, and they'll come down. They can practice their skills, things they might accessing a port properly. They might be nervous to do it on a real patient until they've had a little time practicing on the dummy. It's good that I'm there so I can show them how to do everything correctly. So, and yeah, that's my collaboration reflection video, and I hope you enjoyed it and learned something from me today. Have a good day.